Welcome everyone to the University of Maryland School of Public Health's panel, Celebrating Black Excellence, Stories and Experiences of Black Public Health Professionals, which is part of UMD's inaugural Black Alumni Weekend. This event is being recorded and will be shared afterwards on the School of Public Health's YouTube channel. I'm Chandria Jones, a member of the School of Public Health Alumni Network and a 2014 graduate in Behavioral and Community Health PhD program. This event was organized by the University of Maryland School of Public Health Alumni Network in partnership with the University of Maryland Alumni Association. The UMD School of Public Health Alumni Network works to promote and support the school, encourage academic and professional excellence, and facilitate career development for both current students and graduates, all while fostering and strengthening a lasting relationship between the school and its alumni. We encourage you to support your School of Public Health Alumni Network by joining today and by visiting our website, which is going to be dropped into the chat, but it's sph.umd.edu/SPH Alumni Network. Your membership supports diverse programs and events curated just for our alumni and community, and it's a lot of fun. So with that, I'm going to turn it over to Dean Boris Lushniak for a brief welcome.
Great, well, thank you so much, Chandra, and thank you to all who are participating here today. This is really an enthusiastic moment, isn't it? You know, under the auspices of sort of this concept of the beauty of our school, and yes, to the beauty of our campus community, which is the world around us filled with diversity, filled with an awareness of diversity and inclusion and its beauty, what it brings to our society, brings to our college campus community, and I dare say brings to the School of Public Health. What an incredible opportunity for us to have this celebration this weekend, and for me as the Dean to welcome you to this incredible afternoon event. I am, first of all, thankful to all the organizers of this event, and most importantly, to the message that it brings, not just to our community here in College Park, but also to our students within the School of Public Health, looking at the fact that we are a very diverse student body, that we cherish that diversity, that we love that diversity, and in essence, that we have mentors and role models within our alumni network, within our faculty and staff, who then serve for that jumping off point for students to be able to look at the world quite differently. So thank you so much for this ability to welcome you all here today. I am here enthusiastically and ready to hear the incredible panelists that we have here today. And in particular, to welcome in front of this group, our brand new chair in kinesiology, Michael Brown, here as well. So thank you so much, Andrea, for the work you've done and for the Alumni Network and for the Alumni Association, both at the campus and the school level. I'm looking forward to this event. Thanks.
Thanks, Dean Lushniak. I think we now will begin with introductions here, and I'll begin with myself. So as the Dean mentioned, I'm the new chair in the Department of Kinesiology. I'm also a professor here as well, and I just started in January, so new is really true. I graduated with PhD in 1995, so I've been around a while. After my postdoctoral fellowship, I came back as an assistant professor as well. So we're each gonna mention what Black excellence means to us in our introductions. So for me, I thought a lot about this, and it refers to a high level of achievement, success, or ability that's demonstrated by either an individual Black person or Black people in general. But I think the next step for that excellence is continuous action to make progress in our communities. So that's it for me. We're going to go in order, and I'm going to ask Francine next to introduce herself.
Good afternoon, everyone. My name is Francie Baker. I graduated from the University of Maryland School of Public Health in 2017. And I am currently a postbac fellow at the National Cancer Institute, where I study the functional and genetic association of novel interferons and Burkitt's lymphoma. I'm also the immediate past president of the Maryland Public Health Association, where it has been my immense privilege and honor to serve as an advocate for all those living in the state of Maryland in matters of all things health equity. For me, Black excellence is showing up and being present and making sure that me and my authentic Blackness does everything that I can possibly do to ensure that my ancestors' dreams come true, and that those that follow behind me can continue to build on that foundation that has already been laid for us. And so for me, making sure that I continue the good work that has already been done is what Black excellence means.
Thank you so much. Outstanding. Let's go next with Andre.
All right. Good afternoon, everyone. Andre Blackman here. I'm the founder and CEO of Onboard Health, where we are building a more equitable future of health by really developing a more diverse and inclusive workforce ecosystem. So we're really excited about just the future of health and what that's shaping up to look like, and making sure it reflects and represents, our society. And so class of 2005, just an amazing, adventure and experience that I had at the School of Public Health, even before it became the actual official School of Public Health. And so I'm just excited to just be here amongst everyone here, and just the legacy that we're all building. Black excellence to me means being able to show up as my authentic self and never forgetting where I came from. My parents are from Trinidad and Jamaica, and so just kind of representing that part of the diaspora as well. And also just being in community to be able to be examples for those that are coming next, and then also really being able to honor those who have come before me. And so I really just think that's a big part of Black excellence for me.
Thank you so much. Okay, we will next go with Christina, please.
Hello, everyone. Again, my name is Christina Stennett. I received my BS and MPH degrees at College Park in the School of Public Health. Now I am working as a clinical study director, as well as, clinical coordinator, I should say, and a doctoral student in the School of Medicine at University of Maryland. My work has to do with women's health in general, and then also the vaginal microbiota and how socioeconomic factors as well as aging can make differences in the characterization of the vaginal microbiota. And I'm planning on defending my dissertation in summer of this year. And so when I think about Black excellence, to me, that means when Black individuals and groups can work to overcome the barriers and negative stereotypes that can hold some people within the community back, but then those individuals can achieve the most that they can in life, and thereby representing or reflecting positively upon the culture in general.
Thank you so much, Christina. Okay, Rodman, next, please.
All right, good afternoon. So my name is Rodman Turpin. I'm a research assistant professor in epidemiology and biostatistics here at the University of Maryland, College Park. And I actually also received my doctorate in epidemiology here. Prior to that, my background is heavily in medical microbiology, and that included both my undergrad and my master's work, some related to that. And physician education was a big area I was into. My current work really focuses on stigma, racism, homophobia, and how that affects, and related social and structural factors, and how that affects HIV and STI prevention among Black subject minority men in particular. And I'm starting a big project around that. That's really exciting. So, and when I think of what Black excellence is, I think it is the intersection of Black individual success and Black collective success. And what I mean by that is, I always think of it as, how is my success as a Black person advancing and bringing forward the Black community? And a big part of that comes through in a lot of like my work with my focus on community-based collaborations, particularly for organizations that serve the Black community. And I think that looks, Black excellence looks a lot different depending on what your field is, what your interests are. And there are so many ways to show Black excellence. So yeah.
All right, thank you, thank you. Okay, Crystal, please.
Thanks, Michael. Hi, everyone. It's a pleasure to be here today. I'm Crystal Upperman. I received my doctorate in 2016 out of the Maryland Institute of Applied Environmental Health in SPH and also the MEAS program in CMNS. Currently, I'm the Vice President for Social Performance and Resilience at AECOM. AECOM is an architecture engineering firm. And for me, Black excellence is the manifestation of all the things that my ancestors could and couldn't be in spite of it all. It represents for me the realization of their hopes, their dreams, and their ambitions in my daily life. So back to you, Michael.
Thank you so much. Okay, Maya, please.
Yes, thank you, Michael, and thank you all for allowing me to be here. My name is Maya Walker. I graduated from University of Maryland with my bachelor's in family science in 2013. I am currently graduating from Georgetown University. I'll be graduating in May with my master's in health and public interest. I'm a public health analyst for the federal government, HRSA Resources and Services Administration, specifically in the community-based outreach department. I'm very new to this job. I started in January. So prior to this job, I was actually the health and wellness program manager for the Washington Nationals Youth Baseball Academy, where I focused on underserved communities, specifically in health and security. Black excellence to me really is very similar to what I've heard from a lot of my colleagues. It's really about learning and growing. When I say learning from my ancestors, learning from their journey and the doors that they were able to open for me, and being able to grow from that in a way that I can do the same. I can pay it forward. I can learn and grow and be able to open up those doors for future generations.
Thank you for that. Well, there's two things that are very clear to me. This is an awesome panel. We should all be impressed by everyone. The second thing that's clear to me is I'm the oldest one here, so we'll move on from there. So we're going to begin with questions for each individual panelist now. And then we'll kind of get through that and we'll move towards closing remarks. So we're going to start this amazing discussion with Crystal. She's going to lead us off here with a very important question. So my question for Crystal is, what self-care strategies do you use as you're doing this work as a person of color?
Thanks for that question, Michael. Wow. So I think the question about self-care as a person of color it goes along a journey. I come from a family where I've not seen what self-care actually is. Generally coming from a lower income, growing up in poverty family, care is not something that you often have time for. So I had to learn that taking time for yourself is not necessarily like a benefit, but it's necessary and essential for you to continue on. So that's one place I want to start with, is like getting folks in the mindset that it is critical and essential for your ability to even execute your day in and day out, to make sure that you are taking care and taking time to care for yourself. And that shows up in a myriad of ways. And I feel kind of like I'm preaching to the choir here, because some of the folks here are in the School of Public Health, but it goes in a myriad of ways. I look at it from the physical care and also the mental care. Physical care, I mean, simple things like making sure that I don't miss regular health appointments is critical and important. Go to the dentist, go to your doctor, get your annual physicals. Females, women, get your annual pap smear and gynecological exams done. Get your, get your colonoscopy if you're at age. Just do those regular things that you really should do on a daily basis. and on an annual basis, then on a daily basis, making sure that you have physical activity and proper eating habits in your life. It's really easy to get a stressful response day in, day out. You know, you had a stressful day, you want to drink a couple glasses of wine, or you want to eat some pizza, you know, like your comfort food. Making sure that you have a balanced, well, diet is really important. I lately have grown, I guess it must be with the age, I've really grown into taking personal spa days. Like, it seems like it's a luxury, but it's so critical and essential to just make sure that you have that time to get the physical care that you need. And, you know, you don't have to have a lot of money to be able to do this. Like, simple stuff like setting up, you know, a spa day at home, giving yourself a facial and putting on a mask on your face, and just taking time out, watching, like, you know, some funny movies, like just taking time for yourself, get some aromatherapy going, invest in like a $25 back massage or a foot massage, just stuff like that is really critical and important. And then the mental care. Now, mental care is something that I learned at UMD when I was finishing my PhD. I was really fortunate to participate in some of the classes through the counseling center that taught mindfulness meditation. And I can't tell you how I literally use it every single day. You know, after a long day, when I've had a very stressful day and I can't sleep because I'm replaying the day in my mind, I just put on UCLA's mindfulness and it helps me go to sleep. Therapy is critical and essential. I mean, it doesn't have to be like working, just like talking out in an unbiased environment about just issues that are bothering you is critical and important to help you get past them. Another thing is having a professional support system. It's really critical to have people that you can tap into that will just give you advice and support along just the daily decisions that you're processing in your mind. For me, again, right now, my personal sort of mental tactic is a lot of reading. I take time away to read a lot. And it's something that Maya mentioned in her introduction, not just like reading, you know, modern novels. I tend to go back and read some of the literary work from those in the past, like folks like Carter G. Woodson and Bell Hooks and Maya Angelou. And it really helps me get to the place where I realize that there is nothing new under the sun. All of the challenges that I'm facing today, other folks have dealt with in some way, shape, or form. And if they can navigate and overcome it, so can I. Because it always seems like you're in a world in isolation and things seem daunting. But those are some of the things that I do to just be able to get inspiration and move forward. So I would say overall, self-care is a journey. It doesn't look the same for everyone, but I think it's worthwhile for folks to think about and learn about yourself, learn what makes you happy, and make more time for that in your day-to-day. And that's how you'll feed and nurture yourself.
Thank you. I have a very quick follow-up for you. So how did you go from the environment that you grew up in to being intentional about self-care? You're very intentional now about it.
Well, I mean, we all learn the hard way in that I've dealt with health challenges. And along the course of time, you come to realize that you either make time for your health or you make time for your illness. So that's what I like to pass on to folks, that regardless, you're going to be spending time, but it's better to make time for your health than to make time for your illness.
Well said. Absolutely. Thank you. Okay, we're going to move on. We're going to ask Maya another very interesting question. It's about communication. So, Maya, what are the best ways to communicate as a young person of color with people of older generations?
Yes, that's a really good question, and honestly something that I had struggled with for a while. I think one of the first things that you need to focus on is being confident in what you're coming to the table with. Me as a Black woman, I have to understand that going into those environments where I'm dealing with people who are older than me, first, I'm coming from an experience of being younger. Second, I'm coming from the experience of being Black. And third, I'm coming from the experience of being a woman. All three of those things are coming with different perspectives that an older person may not be able to fully understand when encompassing all three at once. So I think being confident in who you are and what you bring to the table is going to be the first thing. I think secondly is being open to learning. I think a lot of times when we block ourselves off from learning and becoming too confident in what we have to offer and not being open to what other people have to offer us, it can kind of hurt the communication between the older generations. I think the older generations kind of take pride in the experiences that they've had and being able to share it to younger generations. So being able to kind of just translate and just do a transfer of information of, hey, from my perspective as a young Black woman, this is my experience. What is your experience as someone from an older generation? I think that really opens up great dialogue. And I think conversations like that really allows us to propel specifically in public health.
I see. And so I guess a quick follow-up too with you. So what's kind of the greatest challenge to establishing that dialogue for you in your experience?
From my experience, the greatest challenge for me was the confidence part. I think going into those conversations and not feeling like I have anything to offer because I am younger or because of the stereotypes or stigmas as being like a young Black woman, I think that kind of made me very fearful to even engage in the conversation. So I think, that kind of prevented me from allowing myself to speak to older generations because I had that fear. So being able to be confident in who I am and what I have to offer really propelled me to be able to open up to have those conversations in the first place. So I think that was the greatest challenge, was just starting off with knowing who I am so that I can be open to being able to share who I am with older generations.
I see. Thank you. Thank you so much. Okay. This is outstanding. So let's ask Francine a question. Where's Francine? There she is. This is about advocacy, right? So Francine, how do we advocate for ourselves and also the public health professionals, given the differences in the ways the younger generation presents itself compared to the old ways? I'm sorry, Francine. Okay. I thought I saw her there earlier.
Okay.
Oh, there you are. I'm sorry. Do you want me, did you hear the question? I can read again. I think we can't hear you at the moment. You're muted now. Looks like.
How about now?
Perfect, thank you.
Okay, don't know what's happening here, but okay, here we go. So could you repeat the question, please?
Sure. This is about advocacy, right? So how do we advocate for ourselves and public health professionals, given the differences in the ways that the younger generation presents itself compared to the older ways?
Yeah, so that's a really great question. And with advocacy being one of my main passions, it's something that I find myself constantly doing. Quick caveat, I don't know how to advocate for myself. So that is something that I am in the process of learning how to do. I actually seek out individuals in the way of mentors that serve as my advocates, because something that I've learned along the way is that even advocates need advocates. And so that is one way in which we can, address that age divide that we have, is making sure that we have mentors that can help to serve as our advocates, because there are times that we do end up in situations where we are not sure, because either of the color of our skin, because of our gender, because Black women face things differently than Black men face. And so at any given time and point, we are going to need someone who has either been there before us and can help us walk through it, or someone who is currently going through the same thing that we are going through, but might be in a better mindset to serve as our advocates. And so that is how we as advocates, public health professionals, can advocate for ourselves. As the same thing kind of also holds true for advocating for each other. One thing that COVID has taught us is that we as public health professionals are like under attack. We're out here trying to do the very best that we can to serve our communities, to ensure that they are safe, and to ensure that they, in essence, have the best quality of life. And whether it doesn't matter what decisions that we make, we still get attacked for the choices that we make. We can't seem to please everyone. And so we kind of have to serve as our own support system. We have to be the one that stands up for each other. Even, you know, I work for the federal government, and even within the federal government, we have to make sure that we support each other, whether or not we always agree with each other. We're going to have difference of opinions, and that's just human nature. The question is, how do we address those differences? How do we work together despite those differences, so that our main mission, which is ensuring the public health and safety of our communities, are met? And that is by making sure that we do work together, we support each other, and when necessary, we stand up for each other. It's not always an easy thing to do, but it's something that we as public health professionals that we have to do so that we can continue to do the work that we need to do.
Yeah, that's great. You know, your comments about mentors just really rings true to me. The importance of seeking out mentors that really advocate for us. That's important, but it's also important for us to be mentors to someone else too, and help pull them up and advocate for them as well. Thank you for that. Okay, Christina, you ready? Question for you. This one is one I've been looking forward to for a long time. So you're the only Black person in the room, right? We've been there. How do you handle situations? Because we automatically become the expert on diversity, equity, inclusion, and all things Black, right? So you're speaking on the behalf of all Black people. How do you handle that situation?
Thank you so much for that question. I think that's a position that so many of us have been in, where in an academic or professional setting, you end up being the only person of color, only Black person in the room. It's an interesting position to be in, I think, because in one hand, there needs to be some element of representation, especially when you're talking about issues that might impact Black people, it might impact diversity. You do want there to be in the room somebody who can speak to some of these experiences. But then on the other hand, we know that Black people are not monolithic. There are various elements of diversity even within the Black community. So for example, I myself am Jamaican American, and shout out to Andre, who I think mentioned also being Jamaican. I do think that there's a difference between what I can speak to as a child of immigrants compared to Black Americans who have lived here for many, many generations. So I do think that there's an element of wanting to represent, but understanding that you can't fully represent the entire Black community. So in my own work, I end up talking about so the impact of racial ethnic diversity when it comes to my work in the vaginal microbiota. A lot of the times, race and ethnicity end up just being kind of like a variable that we adjust for in our regression models. But there's really not a lot of thought into how about how race and ethnicity can impact us in terms of our health. Like when we adjust for race and ethnicity, are we talking about differences in socioeconomic status? Are we talking about differences in nutrition, in stress over the life course? A lot of different things that could, that race and ethnicity as a topic, as even a variable, what does that mean? So I think that being the only Black person in the room, maybe the only Black woman in the room. There needs to be, what I tend to do is try to speak to the evidence, first of all, also my own experience, and then also let it be known that this is my opinion, what I'm contributing, but it's not the end all be all on this conversation. There are still a lot more voices that should be heard to have a comprehensive voice or understanding about the Black experience globally, I would say.
Yeah, that's very interesting. Yeah, to make the point that it's not just only my opinion, that we should seek out the opinion of others because we all come from kind of a different perspective. When I read that question, I immediately thought about my experience here on campus. As a doctoral student, I was a doctoral student during the LA riots when Rodney King was beaten. And I was that person in the room for a long time. It was uncomfortable for sure. Also, I want to encourage everyone in the audience, if you have questions for the panelists, this is designed to be an open discussion. So if you have questions, please put them in the chat space there, and someone will read those to the appropriate panelists, and we'll move on from there. Do we have any questions from panelists yet?
I think people are still putting them in there, Michael. If you want to go ahead and maybe put a question to Rodman and Andre so that they get their moment, for sure. Thank you.
Okay, Rodman, my question for you is, how do you create a safe space to decompress and build peer networks to lean on? Very important.
Yes, definitely very important. And it's a really good question that I think touches a little bit of a lot of the other questions we've had today. I think in particular, one of the first and most critical steps is prioritizing making time to build those networks and utilize those networks in those spaces. So kind of getting back to the topic of self-care, like I prioritize a certain amount of time in those spaces that are safe and comfortable, and ones where I can just de-stress and relax, and I don't have to have the whole layer of like code switching that I have in so many meetings in academia, where I can really just be myself. And that not only makes me just a happier person, it also makes me a more functional researcher. I always tell my students, like, you can never pour from an empty cup. You just can't. So you have to prioritize keeping yourself, healthy and happy in order to be functional and be able to do the work that you do. And that's why I haven't gotten burnt out quite yet, So I think making that time is really, really critical. And in terms of the spaces themselves, so I've always prioritized really staying connected and just really making time for my intersectional Black sexual minority men spaces. I think especially since my research area is so closely tied to that, there's so many situations where, I guess I want to, I want to de-stress about so many issues that come up related to like how, let's say, other, researchers or outsiders are interpreting or studying our community. And that's a hard thing to do if you're not in a space that, with people who look like you and whatnot. And so really having those spaces, this includes a lot of the Black sexual minority men's organizations in the DC metropolitan area, like that, it's just really so critical because it's one of the few times I can really just say, just vent, and just be honest about, hey, these are some of the things that were challenges and what have you been going through? And, they shared their experience with me. And so it is really, really refreshing to have those people and those spaces in my life. And I think that's just so critical. And really to keep that going, I also try to encourage, my colleagues to both find and build those spaces as well. I think especially for us as Black faculty, like, it is so important to have somewhere where you can drop the mask, and the mask may be, a really heavy mask. It may be a lighter one, depending on how busy how your spaces are, or how busy your work is, or what type of work context you have. But you have to have some space where you can drop that mask and just vent, just be honest, just be free, without the constant looming threat of being the angry Black man, or the overbearing Black woman. Like, you have to have that. It's so critically important.
Yeah, well said. The drop the mask point is always a challenge. That's a challenge. I read someone talking about code switching too, and it's exhausting. Both of those, it's exhausting. Gosh.
Really is.
Yeah. Okay. Next, we're gonna kind of change this up a little bit. I'm gonna ask a couple more questions, and this is just gonna be open for anyone who would like to respond. So we'll have a bit more of a discussion if possible. This is very practical question. So can anyone speak to giving advice or tips on how to maintain Black excellence in public health, given the challenges that we face? And it's already been brought up that public health people are under attack. So any tips on maintaining Black excellence in public health for anyone?
Yeah, I'll jump in with some thoughts there. I mean, just thinking about from a career lens, and that's kind of part of what we're doing at Onward Health, really just kind of looking at the workforce and things of that nature too. I think we're all, especially over the last 2.5 years, right? I mean, it's been horrendous in a lot of different ways when it comes to the work that we all kind of do, touching around public health. And so one of the things that oftentimes comes up for me is that whole kind of career versus life fulfillment juggle, right? And I think we've touched on a lot of that in a lot of different ways. But oftentimes I think, particularly in public health, is that whole burnout, right? On one hand, we feel that there's some sort of mantle of responsibility, social impact, social good, right, that we want to continue to see. Oftentimes, really kind of banging our heads against a lot of institutional frameworks that were literally not built to have public health be successful in the first place. And so oftentimes, right, we run into these kind of situations where, like, we are taking this mantle on ourselves, while also, especially, in Black and Brown communities, kind of taking on the mantles and the frustrations and the historical traumas of our community and bringing that to the table as well. And as we were just talking about just now, right, like, what masks do we have to put on? Like, another question is, who's not wearing the mask, right? And why is that kind of the centralized, kind of measurement for, what needs to look like what, right? And so I feel that, the kind of narratives around how we take care of ourselves, particularly when we're touching things around public health, as professionals, needs to be, addressed up front, right? Robin was talking about having, communities and networks that, make you feel like, you're a human being, right? And that you're not the only one that's going through certain things. And now, just the landscape of mental and behavioral health just really skyrocketing, also in the innovation space, right? Kevin Dedner, also in the area as well, who leads Hurdle, is kind of a mental health tech platform focused on Black and Brown individuals getting quality access to mental health experts, right? And so, really just kind of looking at, once again, like, the career, the work, really kind of detaching from work being who you are, right? That's it, versus really being able to take care of yourself is something that I just want to add into the mix there, that is going to be absolutely imperative for this next phase of work that we're all in.
Yeah, thank you. You're right. You're right. Anyone have any comments on this? Anybody else want to chime in? Okay.
I can chime in.
All right, thank you.
So just speaking on keeping Black excellence within public health, just working with Black communities, specifically underserved communities in Ward 7 and Ward 8, this pandemic really just opened up my eyes to, even though I know I'm Black and I've experienced trauma, but just the trauma that Black people have experienced in the country really pushed these Black communities to not have trust in this vaccine. And me being in the position that I was in, having to be that Black person to kind of exude like Black excellence through educating other Black communities on the importance of not even just getting the vaccine, but educating yourselves and being open to learning and understanding what is out there. I know, their communities have been structured in a way where resources aren't easily accessible. So that the fact that so many resources, specifically vaccines, are being pushed into the community, they were very apprehensive. Like, okay, so what is this about? Is this another Tuskegee experiment? Like everyone was so apprehensive. And even at that past job, being like one of the only Black people there to be able to speak to the Black community, I felt a huge weight on my shoulder, having to be that advocate for the COVID vaccine and having to be the one to kind of just educate. And I feel like that is a great example of just kind of continuing to use Black excellence in public health, understanding that we have our own unique experience. There was a doctor, her name is Loretta Ross, who had once said in a seminar that I was in, how we can get into these situations where we're around other people with these great degrees and all this education. We can kind of shy away from our experience, and our experiences makes us an expert. Me being a Black woman in healthcare alone makes me an expert as a Black person dealing with health disparities. I have children. I've been in a system where I've dealt with racism and people not being educated about maternal health and the disparities within that. As a Black woman, I feel as though it's very, very important to own our experiences and use that to show Black excellence, to teach other Black communities. It really just blew my mind though with this pandemic, how fearful, because of all of the trauma that our Black communities have experienced, how fearful they were to receive help. And it's very important as Black public health professionals to kind of ease some of that fear, say, hey, we're in public health, we're doing the research, we understand where you're coming from, but let me educate you and understand why this is important for you, why this can be helpful for you.
Yeah. Thank you, Maya. Let's get into it, right? Oftentimes, as we're showing up, there's a lot of historical aspect to what a lot of us are facing with today, right? And this is a big part of, public health and healthcare in general, is that there were atrocities that still are getting, the ripple effects are happening today, right? And so it's never what's just happening right now, right? It's usually what's happened and also the structures that have been put in place to keep it going, right? And if we're talking about trauma and once again, Maya, as you mentioned, right, just owning those experiences, there's a lot of things that people are just now getting an understanding of about why there's the socioeconomic aspects of what also leads into what we're all battling right now, right? I remember, I think the show Watchmen that came out really just kind of blew the lid off of the Tulsa, Oklahoma massacre that a lot of people had zero clue that happened, right? And these are all the things that kind of lead into the work that we're doing, how we're showing up, and why oftentimes people are so puzzled by folks in our community talking about microaggressions or larger aggressions, right? The Crown Act that just recently came up about natural hair, it's those kind of things that we're all shouldering at the same time, while specifically in our community or in our kind of field right now, we're also having to work on solutions, right? When ultimately, it really kind of boils down to things like empathy and dignity. And those are the kind of things that I feel like get overlooked quite a bit. So these are the things, the principles that I'm hoping are starting to come out as far as roots that we need to address across the board for ourselves as professionals, but also for our industry.
And I would also like to add, it's really one thing for us to know the history, but it's another thing for us to be able to share our truth. Every Black person has their own story to tell. And historically speaking, we don't. It's already been mentioned that generally speaking, we do not talk about, our problems. We kind of keep that to ourselves. That's part of the reason why mental health within the Black community has been such a big thing. We're getting to the point now where the newer generation, we're like, okay, this is a problem and we need to talk about it. But the older generation, they're like, you're not supposed to talk your business, it's personal stuff. You don't share, you don't tell anybody that stuff. But we know better now. And when you know better, you do better. And one of the things that I believe is really critical to us making sure that we change the direction of the Black community and mental health in particular is making sure that we don't just share our stories in enclosed spaces. And I fully understand that a lot of us have stories that are traumatizing. I'm currently going through something that has re-traumatized me, and I'm trying to work through it myself. And I realized that when I verbalize it to people, it is a way of me of releasing it instead of just me writing it down. When I write it in my journal, nobody heard it. And if nobody hears it, nobody knows that it exists. Nobody knows that it exists. Then nobody knows that it's a problem that needs to be solved. And it's not just a me problem. It's other people who's also going through the same kind of trauma that I'm going through. And while journaling is good, and while meditation is good and prayer is good and all that stuff is good, so if you're doing it, keep doing it. What I'm saying is we have to get to a point where we share our experiences with others in a space where we're getting it out there so people knows that that they're not alone and that it's okay to not be okay. We've heard that so much during the COVID-19 pandemic where people are saying it's okay to not be okay. But how many people are actually out there saying, I'm not okay?
Right.
And then telling you what it means to not be okay. And so I feel like, as we talk about Black excellence, if we are truly going to be excellent, we have to drop the mask, like what we talked about. But part of that dropping a mask is having to be vulnerable enough to share our personal experiences so that not just our people, but our allies as well know that, hey, this stuff is real. It didn't happen back in Tuskegee, but it's happening now, and it has happened to me. And you need to know that so that you know that this is not just something that we need to get over.
Absolutely, absolutely. There's been some discussion about our peer networks today. So do you rely on your peer network to communicate these things too?
Yeah, absolutely.
Yeah, absolutely.
Yeah, peer-to-peer mentoring is important. Having like Chandra mentioned, she has a Black Girl Magic happy hour. I need to get in on that because that's where you start to feel comfortable with sharing. But beyond that, I feel like it gives you the strength that you need so that you can share with others. Yeah, I'll leave it at that.
Okay, great. Thank you so much. Okay, I'm gonna have put one more open-ended question out there again. Anyone feel free to jump in on this. It's really takes off just where you left off, Francine. It takes off right there. So someone else can speak to this. How do you deal with microaggressions or even overt racism in the professional sphere? Personally, I just had a person come to me today. Again, I'm the chair that experienced a microaggression and wants to talk to me about it. So like you said, Francine, this stuff is happening today. It's happening now, right? Okay, does anyone want to speak to that?
I can chime in on that a little bit. So, I mean, you're going to experience it as a person of color. You're going to deal with microaggressions. You're going to deal with offenses on your character based off of stereotypes. I mean, it can range from being in a store, purchasing items, and being assumed that you are the person who works there and is to check people out. It can be in the office speaking about something and sort of having to deal with the notion of you are the expert at the thing, but being told that, you know, your voice is not necessarily as valid as others. And this is where it gets to understanding and knowing your wealth and knowing your value. We all have, we're all individuals who are on this panel, well-educated individuals, and there is power in your presence. And you don't have to stay where you are valued. And once you get to a place where you eliminate the fear of stepping away and walking away, then you realize and understand that you don't have to subject yourself to other people's perception of you. And you can speak out on that in a diplomatic way. And then you can also exercise your agency and remove yourself from places that have been deemed to show you that you're not valued, or you're being undermined, or you're being, consistently having to deal with microaggressions. And the thing about it is, of course, someone spoke earlier about the differences in generation, where it's kind of like everyone's situation is different. You may have to deal with sort of certain life circumstances. You may not feel like you have the privilege, but actually, I think we all have the privilege to act with agency. As long as you have a bachelor's degree and you're well educated, you have agency. You have agency to take yourself and take your talents elsewhere if you're not being valued. And I think, it comes to a point of getting in the mindset of having a zero tolerance policy for microaggressions, because it really erodes the ability for us to show up as our full self in work. It erodes our ability to show up as our full self in society. I shouldn't have to be concerned that if I wear a particular pair of tennis shoes, that someone's going to assume that I am of a different stature than what I truly am. There's a dimensionality and multidimensionality to being a Black person in America. We like various types of music. We like various forms of art. We like various types of social settings. I like to do my hair multiple different ways. I like colors. I like patterns. It's all a part of my diaspora and who I am. These are things that are genetically ingrained in me from a cultural perspective. So to essentially shun away from the things that are natural for my being, like knowing how to braid my own hair is natural to me, that doesn't just, why should I just erode and eliminate that natural given, connectivity to my ancestors for the sake of a paycheck? So I say that to say that once we get to a place of having agency, knowing that you have agency, knowing that you have options, and using to exercise that is where you will, eliminate and erode some of the impact that system of microaggressions can have on you. And I'd love for anyone else to sort of chime in, because these are all things that have happened to me.
Yeah, that is excellent. Can someone else speak to this? This is very important.
Yes, I'll definitely follow up. I think the short answer to, what do you do when you are experiencing microaggressions? You have to speak up. You have to speak up really loudly, really vocally, and to share an experience that I had as a student. So originally my, undergraduate and master's background was at Howard University. And that's where I worked in the hospital as a medical microbiologist. And that was kind of like my central bubble. So there are a lot of forms of racism I just never really saw or experienced. When I came to UMD for my PhD, it was my first month there. And remember, I didn't know where a classroom was. So I wanted to ask someone who was walking outside, so it was like maybe 3 p.m. Hey, I was like, oh, hey, and I wanted to ask her, oh, do you know where this room is? And she puts her purse out in front of her. Like, she says, oh, here, like, as if she thinks I'm trying to rob her. And I'm like, no, I don't want your purse really. I just want to know, where this room is. And so, you know what, it's fine, I'll just go. And it set the tone for, some things that I was going to have to deal with, coming to a predominantly white school that I really did not have to deal with much before. And at that time, I didn't speak up, to be honest. I was like, oh, I'm barely a student here, I don't want to cause any trouble, they'll just think I'm like, someone who stirs the pot and it's going to be an issue. And I didn't say anything. And looking back, I wish I had. And as I, kind of grew and, got more agency, as was mentioned, and felt like, okay, I have more agency to speak up on certain things, I did become more vocal on that and on issues like that. One situation with a reviewer a year ago who reviewed a paper and just had some very clear racial biases. I reported him to that journal. I reported him to another journal he was an editor on, and I'm sure I'm going to tell everyone who's relevant professionally, to this person reviewing papers, because this is a huge issue. And ultimately, you have to do that, and it does kind of get into, what Francine mentioned about, you have to speak up, not just in your spaces, but outside of them as well. And I think that's, we're dealing with those microaggressions, you have to do that, because otherwise people just pretend like they don't exist. Then, or it's just an isolated incident, it's a bad apple. But as we know, it's never just one bad apple. That's not how it's ever been. So yeah, you have to talk.
Absolutely. Absolutely. You have to deal with it right then and there. Okay. Getting a little feedback from someone. Can we mute this person? Okay. Okay, well, if no one else has anything to say, I'm extremely proud of this discussion. This was outstanding. And should we try to take some of the questions in chat, or should we just, okay, someone wants to. Should someone read those out or what?
So I can help you out there, Michael. I was kind of keeping track. There was one question in the chat wanting to know, can you speak more to strengths-based approaches to outsiders, quote unquote, interpreting and working with communities in which they don't hold the same identities? So I think that question is really related to what are the messages that we need to be given to allies to really kind of help in the conversations in terms of addressing some of the topics that have come up.
Great question.
I'll really quickly unmute and just say also, not even to Ali, but what are the messages that I think this also comes up like in research and community-based work. So as outreach is happening, so that if this is meant to be buy-in for the community, and then that messaging comes across as it's not, and it's actually hurtful. I don't know if that helps a little bit more with that.
Yeah, I'd like to jump in for this one if it's okay. I think one of the important messages that I would like to convey to allies is that we're all learning. I think one of the things that the George Floyd, Breonna Taylor, Ahmaud Arbery incidents and the big Black Lives Matter movement of 2020 brought to the forefront is that collectively, people are just tired. They're like really, really just fed up. And it's not just Black people that we saw that are tired of the injustices that we see. And so there are a lot of white men and women that want to help in dismantling systemic racism and serve as an ally to the Black community. One thing that I think that we have to be mindful of is that it's a learning process. I highly recommend reading White Fragility. And I just recently read Black Fatigue. And there are many other books like that. They're really great books that help us in understanding what is happening and what it means to be an ally. But we have to be patient. We have to realize that it is indeed a process, and we're learning to work together for the good of the Black community, which means that the Black community has to be the one to drive. We have to be the one to drive how things are changed. In that, just because you as a white person might think this is how things should be changed doesn't necessarily mean that's the way that we want things to be changed, right? There were so many different things that transpired, so many different changes that occurred during the whole Black Lives Matter movement, and Black people ain't asked for it, and they were not very. They were superficial at best, right? And what we really want is to be able to show up and be present in all our Blackness without something like a Crown Act to tell us how to wear our hair, right? What we really want is to be able to have seats at the table without being the token Black person at the table. What we really want is for systemic racism to not exist within our places of work and within our academic institutions. Those are the things that we really want. So it's really important that when our allies show up within our communities, whether it's the research that we do or whether it's in, DEIA conversations or whatever, that they take the time to listen to what it is that we really want and not just impose what they think would help in addressing the issues.
And yeah, I would like to add to that. Like she said, we want to be patient, but we also need the allies to be empathetic and understand that the Black community has gone through a lot, and just having a new face come in wanting to help is going to take time to establish that trust. I also want to say, as far as working with Black communities, and from just my experience, consistency is key. So there's going to be some type of resistance to help if the Black community feels like they're being treated as lab rats, just to put it very, very bluntly. That is something that I've heard on numerous occasions from me, even being a Black person working with the Black community, that you have these allies or organizations come in wanting to help because they have this grant or this initiative, and then once it's done, they're out. And I think that has really hurt the trust within Black community dealing with specifically in public health. So I think consistency, patience, having empathy, that's the message that I really want to relay to allies and anyone just wanting to help and work within the Black community dealing with public health. That is going to take time and consistency. I mean, it's a commitment. If you're going to want to commit to helping the Black community, it's not something that you could just pop in and out of. It's going to have to be an ongoing process. And that's a huge task to take on. But as a Black person, it's not just a task for us, it's our life. These are things that we're dealing with. This is where we're living. So if you're saying that you want to help, you want to be an ally, know that is a lifetime commitment, because these things are going to continue. It's not just going to stop after, working hard to help the community for 5 years. This is a lifetime commitment. We're stuck in it for a lifetime, having to deal with these things. It's a commitment.
Yeah, Maya, and just to jump on that as well, right? I mean, specifically like with public health, as you mentioned, like grants, research, like if there's any kind of intention to extract data, insights, picking your brain, all that kind of stuff, you first have to ask yourself, what are you investing, right? And this is what you're just talking about over the long haul. Before you start asking for things, what have you invested already? If it's minuscule, if the answer is nothing, you already know what you're going to get, right? And
Right.
so, and I think over the last 2.5 years, like this has become like really critical for people to understand, especially if we're talking about allies, research institutions, public health. Like we can't come out to these, health fairs, right, and just do a little dance and say like, okay, like, this is what we did to the community. Like, what have you? And that's why I said the word invest instead of just give. Oftentimes these communities are over the little tchotchkes or whatever that oftentimes get handed out. It's like, what have you actually invested in this community, and what do you know about it? And so I think that's another piece to the longevity and sustainability of this kind of work.
And, not just stepping in, trying to give the community what you think they need, but being open and understanding, what they really need. And just using COVID as an example, going into these underserved communities, pushing these vaccines, they're like, hey, yeah, we understand this, but we've already been going through a pandemic long before COVID hit here with food insecurity. We don't even have access to healthy food. We're sitting here fighting for our lives, trying to feed our bodies with healthy food. And, you're trying to push this other pandemic on us with the COVID, but no one's helping us over here, so not trying to just come in and force what you need to fulfill because of like a grant or research, like we've said before, but really taking the time to invest your time and to really understand what that community needs and follow through. Just getting the information is one thing, but you're going to get resistance if you're always coming to get information, but then you get that information and do nothing with it. You need to follow through.
As well, there should be resistance when it does not appear to be a genuine act or ask. So yes, absolutely, there's resistance, and there should be. Do we have another question from the audience? Our time is, I think we're good with time. Is there a good question anyone can see that we might want to ask the panelists?
I actually had a question that I have thought about a couple of times, and I wanted to see if the other panelists might chime in. Is that okay, Dr. Brown?
Sure.
Okay. So I think it was kind of mentioned by Rod earlier about the whole stereotype as angry Black men or angry Black women, and how that affects you professionally. Is there a way that you can voice issues when it comes to microaggressions or bigger acts of racism, disagreements with other colleagues, even if it pertains solely to your work or anything like that? How do you speak up without falling or fear of falling into any stereotype?
That's a really good question. And I think it is one that's especially more challenging when you have those bigger power differentials, but honestly, the most important thing, or the thing that I think is a big first step to that, you have to not be afraid of being seen as the angry Black person. That's the first step, because when you voice any type of discontent or concern about some issue, there's always going to be someone who will see you that way, if not everyone. That is an unfortunate reality of, the racism in all of these institutions, to be honest. But you cannot let that deter you from speaking out. And, honestly, I started to think of it more and more as, yes, this will be uncomfortable for me in this moment saying this. There may be some, pearls clutched, in this meeting or something like that. But one, it's important for my long-term success. So, because if I don't speak up on this now in a way that is really clear, it becomes easier and easier to ignore by the people around me. But two, the other thing is, oftentimes I'm in these meetings with other Black colleagues or my Black students and such, and I need them to see that it's okay to talk about this and it's important to talk about this. So I think it really is getting over that first hump that, yeah, you're going to be seen as angry, but, and you got to push, but you do have to push through that in order to speak up on these issues. And, I get that that's difficult. That has been very difficult for me, to be honest. I think being in some of those, safer spaces, as has been mentioned before, it builds up your strength to be able to take that confidence and ability to speak on these issues into some of these spaces where those microaggressions are really happening. So I think that's the most critical thing. And, related to that, look for advocates, because I found, some specific, very good advocates, here in this institution, in many of the other institutions I work with, like there are people who are really good advocates for issues like this as well. So, leaning on them, really helpful. And, especially for like a larger institution like University of Maryland, your DEI office is going to be really helpful when it comes to a lot of stuff like this. Like my experience has been like at institutions that have these offices, like they do take these things seriously. And they are, they are an important resource to lean on as well when it comes to, dealing with microaggressions and such. So, a lot of different like avenues to approach that. But I mean, the first step is, just really acknowledging that, yeah, you're going to ruffle some feathers, but it's the only way you're going to succeed in the long run. Like you're going to have to ruffle some feathers at some point. Mm-hmm.
Yeah, I think it's important to let them know that this is the way I am receiving this. This is the way I hear this, and I don't like it. So I kind of use that so the defensiveness doesn't pop up right away, but this is how I'm hearing this. I just want you to know that. Anyone else want to speak to this?
I also think too that sometimes what is seen as being an angry Black woman or angry Black man is passion. Nobody's angry.
Right.
We're just passionate about whatever it is that we feel or we're sharing. And I think that also goes back to what was said earlier about, how we are different. We express ourselves differently within our music, within our art, the way in which we dress. All of those different things have to do with how we are culturally diverse, right? So I'm also from Jamaica. I was born there and came over here, when I was a young girl. And I'm telling you, when we get excited, we get loud, right? And as well spoken as I am, when I get angry, so when I'm angry because the patois comes out, right? So it's what's seen, and this, I think, also goes back to that question on allyship. It's really understanding your community. If you understand that when we're loud and being expressive, we're not angry, we're just, excited or we're passionate or we're happy, then that term, angry Black woman, angry Black man, could probably just be eliminated altogether. It may never be, but it's also just a part of who we are, in the way in which we express ourselves. And in understanding that, then I think it other people will better be able to relate to us, especially when it comes, when we're in the workplace. For me, I know it's something that I'm constantly am mindful of. Am I too excited? Am I too loud? Did I use my accent? That's the whole idea behind the code switching. And sometimes I feel like even when I'm within the presence of Black people, because I'm at work, I still have to be mindful of, you know, how I say things, what I say, and how I express myself, because I don't want the collective to be misrepresented, right? So it's just one of those things where I am constantly mindful of the tones that I use, the how I, you know, the inflection within my voice, like it's exhausting. but yeah, it's I think it's really would be helpful and beneficial as our other public health colleagues just understand that it's more than just anger. It's our expressive nature.
And someone mentioned in the chat too, even if we do happen to be angry, we have the right to be angry as well. We have that right to be angry. Yep.
I agree with that. But I also want to say that I think it is very important to understand that sometimes you may not always experience microaggression from people of other races. And I think that's something that we may not have talked about, but you may sometimes experience other Black people who do not agree with you, who may speak down on you, you know, that is also very common as well. And that's always very difficult when we do face that challenge or that barrier in a professional workplace. You know, I don't want to create this idea that it's always like race against race, but sometimes, you know, it's other Black people who are also exerting some of this negative energy and stereotypes on us. I mean, from my experience, it's typically a generational difference, but it is still something that we experience. You are going to experience microaggression from someone who's within your same race, another Black person. And I think, again, the best way to deal with those situations is to speak up. I feel like that is the only way that you're going to be able to learn. That is the only way that you're going to be able to move forward. And I believe that we're here doing what we're able to do because our ancestors ruffled some feathers. They didn't care about being labeled as the angry Black woman or the angry Black man. And that's why we're here doing what we're able to do right now. And I think it's very important for us to stand confidently in that and understand that we're going to have to face some of those challenges. We're going to have to ruffle some feathers. But see, I have 2 little girls. I'll ruffle some feathers to make sure they have the same opportunities, if not better, you know, than what I had. So I think it is very, very important to own it. You know, if they want to call me an angry Black woman because I'm speaking my truth and I'm going to say that I don't agree with, you know, something that's being said, or I don't like the way that I'm being treated. Hey, I guess I'm an angry Black woman, but I'm going to speak my truth and I'm going to say how I feel. And I feel like it's always about how you do it. You know, you can still do it in a professional manner. You can still be angry and still express yourself in a professional manner. I think it's a stigma where people think when you're angry, you're going to act very irrationally. No, you can still be professional and express yourself out of anger. And that's healthy, and that's okay. So, I mean, I don't want to present things as if it's all just like fluffy flowers. No, it's uncomfortable. You're going to ruffle feathers. It's not easy, but it has to be done. And there's always an appropriate and professional way to still express yourself.
And it's so funny. I just want to jump in real quick. If someone's watching this and they have no audio, all of Maya's head shaking is gonna make people think she's an angry Black woman.
Right. Okay, we are moving to the last 10 minutes here, and one kind of last thing. This is for young folks who are just getting into the field of public health, and so I would like to give the opportunity for the panelists to just take a minute and provide a tip or maybe some advice for people of color who are starting out in the field of public health. Just one short bit of advice.
Yeah, I guess I'll start. Look for good mentorship, and specifically look for Black faculty mentorship. I have found that to be so critically helpful. My primary mentor in my department, Tiffany Dyer, has just been an amazing resource, both professionally and for navigating so much of what Black faculty go through. I cannot stress that enough. And that, an academic institution that may be faculty in, another like institutional research or other public health institution, that mentorship may be just someone else who's higher up in your kind of position. But finding a good senior Black mentor like in your field is so critically valuable. I would strongly recommend it.
I second that for sure. Anyone else want to give a little advice?
To add on to mentorship, just because I was always afraid to put myself out there and network. So just to give some advice on how to get a mentor. It can be as simple as sending a nice email or meeting invite to go grab coffee, just expressing how you are very impressed or you admire the work that they're doing and you would just like wanted to take a moment to, maybe pick their brain. Just don't be afraid to send those emails, make those connections on LinkedIn. Even mail a letter. I know that's very old school, but I've even done that as well, so those are just some unique ways I would say to find a mentor. I know for someone like me who is just very, very like much an introvert, kind of doing things on the computer and maybe sending a letter might be a little easier for you.
I'll add to that. Mentorship really is important. Networking is really important. And I'll also say, follow your passion. Do not let other people deter you from what it is that you truly want to do. I knew for a long time that I wanted to have a career that was public health based and centered around immunology and infectious diseases. And I felt like on either side of that, I met with pushback, like, why do you want to be an immunologist if you have a background in public health? And why do you want to be a public health person if you're trying to pursue immunology? I'm like, why don't you see that the two kind of go together? COVID-19, perfect example. But I continued to push for because I knew what it is that I was striving to do. I didn't always fully understand how to express it and explain it or what it would look like. But because of mentors and because of networking, I was able to get to the point where I am today, where I am doing what I want to do and soon will be continuing my education at University of Pennsylvania with a studying immunology. And that program is centered around public health. So don't let anyone deter you. Don't let anybody tell you that you can't, because you can. And with the right mentor, and if you reach out and you expand your network, you'll definitely be able to.
Absolutely.
Michael, the only tip I have is for a young person coming out, public health, say yes, no matter what it is. It is so critical for you to get diverse experiences, to truly know what it is you want to spend your time doing. I come across a myriad of people who I'm like, hey, there's this opportunity. And they're like, let me think about it. And I'm like, what are you like? I literally just handed you dinner on a silver platter and you're going to think about it. Like, there's always ways to come back and say no. But if there's anything that you can do for your forward progression is to always say, yes, I'll consider it. Think about it. Don't just let opportunities go by the wayside. Don't spend time overthinking things, because you just never know the journey that you can go on by just simply saying yes to opportunities. You don't know the things that you're able to learn that can prove to be fruitful later on in your life because you had that experience early on. I think young professionals early in your career, your whole mission is to learn as much as you possibly can to be able to bring all of that together, to bring diverse and also poignant solutions into the fold, because we're going to have a lot of challenging problems to face in the next decade. A lot of problems. I mean, we just faced a big problem with the pandemic that we still haven't really solved. And we have the whole issue of climate change that's going to disrupt all of our systems. So I would implore folks to be very diverse in your experience, even though you're in public health. Try to get experience and expertise in other fields also to be able to be a better health practitioner also. So that's just my recommendation.
Thank you. Thank you. Okay, so before I hand it over to Chandria to close us out here, first of all, I just want to say I'm blown away by your wisdom. It's amazing to me. So it's been an honor to be the moderator for this panel. And with that, I thank you all. Let's turn it over for closing remarks.
And before it hands over to Chandra, Michael, I do want to, first of all, on behalf of the School of Public Health, thank all the panelists. Thank you for being the panel lead on this. And, you know, something really touched me in this last sort of segment, and in particular is the whole idea of mentorship, right? And I actually appeal to all of you, right? You know, part of the struggle always in this world is making sure we have the mentors in place, whether they're internal or external to the School of Public Health, because I think part of mentorship could be done through the Alumni Association. It could be done through our current PTK and TTK staffing. It could be done through friends. It could be done through sort of connections. The concept of mentorship really is wide expanding. The last aspect is, we go through hiring spurts here. And I think part of it is to make sure that we have diversity and inclusion and as part of our strategy. And certainly that's the strategy within the School of Public Health. I want to build up the cadre of mentors, right, within our school, and mentors of color, so that we do reflect what our students look like. So thank you all for a great presentation today, and back to you, Chandra.
Thank you for that, Dean Lushniak. And thank you to our panelists and all of the folks who are joining us online. This has been a powerful conversation, and I hope you all have taken just as much from it as I have in terms of, knowing what Black excellence is, strategies for self-care, the importance of mentoring. All of that really will play into our careers as we grow as public health professionals. Just a few reminders, this has been recorded and will be available on the School of Public Health YouTube channel. And so feel free to go take a look at it again, share it with your friends. Also, if you are attending any of the in-person events for UMD Black Alumni Weekend, be sure to check yourself in at the Riggs Alumni Center. And if you've enjoyed this panel and if you want to build your network, we are accepting applications for the School of Public Health Alumni Network Board, and those are due April 30th. And we would love to have some folks join us as we put together great programming and support students and alumni. So thank you all for coming. Thank you for participating. Thank you to Jennifer, Gretchen, and Aaron for help putting all of this together, and enjoy the rest of the inaugural Black Alumni Weekend at the University of Maryland.